Welcome to This Explainer. Today, we're demystifying a super common pediatric injury that honestly strikes fear into the hearts of parents and caregivers everywhere. I mean, if you've spent literally any time around toddlers, you know exactly how lightning fast they move and how often we just instinctively reach out to grab their hands. But could that totally natural, everyday reflex actually be doing damage?
To kick things off, take a look at this viral Instagram post from a creator called MotherPostBaby. This thing completely blew up. We're talking over 10,000 likes and a whopping 72,000 shares. The warning here is super blunt. Simply lifting a young kid by their arms, or even giving them a fun, playful swing, can cause one of the bones in their elbow to literally slip right out of place. No way, right?
So, it really makes us pause and ask ourselves, is swinging a kid by their hands just, harmless, everyday play? Or is there a genuine, hidden danger lurking there waiting to happen? Well, let's dive in and find out. Let's start by looking at the medical reality behind this massive viral claim. Are these social media warnings actually backed up by clinical science?
As it turns out, the viral post is spot on. Pulling on a kid's arm absolutely can cause what doctors officially call a radial head subluxation. Now, you've probably heard it called by its more common everyday names like nursemaid's elbow or babysitter's elbow. And let me tell you, it is a very real, very frequent pediatric orthopedic issue that emergency rooms deal with all the time.
To really grasp how such a minor, harmless-feeling tug can cause so much trouble, we actually need to look under the skin. We have to visualize what's going on inside the developing joints of a child's arm. Take a look at the annular ligament right here. In a normal, healthy elbow, it acts kind of like a tight, rubbery strap. It holds the radius bone firmly pressed against the ulna bone, which is what allows a kid to rotate their arm freely without everything falling apart. But this side-by-side view brilliantly shows exactly what goes wrong. On the left is that healthy joint, but over on the right, you see the injury. When forceful traction is applied, which is really just doctor speak for pulling the arm straight down along its length, the head of the radius bone gets yanked down. Because little kids have super pliable, stretchy connective tissue, that annular ligament just slips right off the bone, and boom, it gets painfully wedged right into the joint. So who's actually in the danger zone here? Well, clinical data shows this injury heavily targets kids between the ages of 1 and 4. In fact, if you look at emergency room records, the average age of a child coming in with nursemaid's elbow is right at 2 years old. But hey, here is some fantastic news. Kids actually grow out of this entirely. As they get older, the top of that radius bone physically changes shape, going from kind of conical to a wider, more cylindrical shape. Plus, their ligaments naturally toughen and tighten up over time, so this structural evolution is a real game changer. It makes nursemaid's elbow incredibly rare in older kids and adults. Okay, so we know what's happening under the skin, but how do we actually spot it in real life? The symptoms can be surprisingly subtle if you don't know exactly what to look for. Usually, the pain kicks in immediately right after the arm is pulled or lifted. But here's the tricky part. Unlike a broken bone, you almost never see any physical swelling or bruising or weird bends in the arm. Instead, the child will have what doctors call pseudoparalysis. Basically, they'll just completely refuse to use the arm at all. They'll tuck it in close to their belly, keep the elbow slightly bent, and turn their wrist so the palm faces the floor. And if you try to flip their hand over, they will absolutely resist because it really hurts.
Interestingly enough, the medical data shows a slight trend for this to happen more often to girls, and specifically to the left arm. And get this, while we know it peaks during those toddler years, it can actually happen to babies under 6 months old, literally just from the mechanics of them rolling over in their crib and getting an arm caught under their body. Now, seeing your toddler suddenly refuse to move their arm is absolutely terrifying. But the good news is the medical fix for this is incredibly fast and completely non-invasive. No surgery required.
Once a doctor makes sure there are no signs of a fracture, no crazy swelling or bruising that might need an X-ray, they'll perform a super simple procedure called a reduction. And the best part? No drugs, no sedation. They basically grasp the elbow and wrist, gently apply a very specific rotation, and then they literally feel a physical click right under their thumb. That pop is the trapped ligament snapping exactly back into its proper place. Now, physicians generally choose between 2 specific maneuvers to get that satisfying click. On the left side, you've got the setup for the traditional supination technique, which involves turning the arm palm up and flexing it. On the right is the hyperpronation technique, where the doctor kind of shakes the kid's hand and turns the wrist firmly inward. So what's the bottom line here? Well, clinical studies, including major data from the New England Journal of Medicine, prove that the hyperpronation method is actually way more effective. It boasts a staggering 95% success rate on the very first try. Compare that to just 77% for the traditional supination method. It's also reported to be less painful for the little one. And honestly, the craziest part is that usually within 5 to 30 minutes after that ligament clicks back in, the child is totally fine, playing and using their arm like literally nothing ever happened.
All right, now that we know exactly how this happens and how doctors fix it, let's talk prevention. Let's lay out some crucial ground rules for protecting those growing little joints.
The absolute biggest takeaway from this explainer is to rethink how we carry and play. Always lift a child by grasping their torso securely under the armpits. This distributes their weight evenly. If they're old enough, encourage them to help out by raising their arms and using their core muscles. And please, completely avoid the big don'ts. Never pull a kid by the hands or forearms. That means no more of those playful airplane swings by the wrists. Don't yank them up a curb by one hand when they're lagging behind. And be super careful not to forcefully tug an arm through a tight, sticky coat sleeve.
And you really need to be extra cautious if a child has experienced this before. As the Mayo Clinic strictly warns, once that little annular ligament has slipped out of place the first time, it becomes much more prone to slipping out again in the future. It's kind of like a stretched out rubber band.
So, armed with all this incredible medical insight, are you ready to change your everyday habits? The next time a toddler reaches up for your hand, I hope you'll remember the fragile science of the elbow. And honestly, it kind of makes you wonder, right? What other totally normal, everyday childhood habits might be hiding invisible risks to their developing bodies? Thanks so much for joining me on this explainer, and keep asking questions.